So I'm really grateful to get some client testimonials on video because I think that's just so important to hear it from the horse's mouth. So thank you very much, Kirsty, for volunteering. You've been like one of my clients. So can you tell me a little bit about how you found me and the kind of why and why you decided to come and have IEMT?
Okay. Well, I've got quite a lot of past trauma in my life and things like that. And I had been actually speaking to my nail technician about it last year, and she was telling me about yourself, and I thought, hocus pocus nonsense, absolute rubbish. There's absolute how is that going to work? No, you're fine.
Hmm.
It's not for me. So I just left it. But then I continued to deteriorate my mental health.
Hmm.
And in February, I hit rock bottom, and basically, I really didn't want to be here anymore. I didn't know how I was going to go on.
Yeah.
I tried the generic channels like NHS and whatever, but obviously was badly let down. And
Hmm.
then I thought, do you know what? I'm going to give Emma a try. At that stage, I was just like willing to try anything.
I'll try anything Emma will be.
Yeah, and fully expecting to come and go, see, knew it was rubbish.
Yeah. Okay. So what kind of things were you experiencing at that rock bottom? I know you were having like some flashbacks and things like that. Is that
Yeah,
right?
I was actually, if I'm being 100% honest, I was being tortured, absolutely tortured with the flashbacks. I couldn't get them out of my head. I couldn't function. I couldn't be a good mother or
Mm,
anything because, like, these flashbacks that they've been coming and they've been coming, but they just got so bad in January,
yeah.
February time that like I couldn't control them any longer. And it was as if they were taking over my mind. I've had flashbacks for many, many years,
Yeah.
and I've had problems with mental health due to traumas. But like early this year, it just was bad.
Yeah. So the things that you were experiencing were like life limiting, really, like keeping you
Mm-hmm,
stuck
mm-hmm.
in so many ways. Okay.
Yeah,
So you came to see me in March, is that
yeah,
right?
yeah.
Yeah. And how did you kind of find the first session?
This is very hard to describe, you know. Like when I remember coming out of the session and like my family were all like, you know, desperate to find out what happened. And I was just like, and it's not like me, but I was just like gobsmacked. I didn't know how to describe it. Like, I came in, we didn't even have to go through like into great detail of I thought I was going to have to drag all the traumas out, you know, like speak about it for ages and go right into it and everything. Whereas it wasn't like that. And like we done the eye movement thing, and I'm like, right, okay, how's this going to get rid of it? But then after like these now bearing in mind these things were life limiting, as you say, and torturing my brain. Like after one session, the ones that tortured me most, like were just grey.
Yeah.
And like
Yeah.
I, like I kept trying to bring them back. And my daughter says to me actually, stop trying to bring them back in case you bring
Scary.
because
Yeah.
yeah, because I was so scared that they were going to come back again
Yeah. Yeah.
because like I left you at the first and I've got like complex traumas.
Hmm.
I left you at the first session, like just what the hell happened there? What did she do? You know, like it I find it hard to explain to anybody and I
Yeah.
often say to anybody that's got traumas, just go and try it. One
Yeah.
session, you know, like and then you'll understand what I'm talking about.
Hmm.
Because like you don't think just somebody doing something like this or whatever's going to like basically give you your life back, you know, but
Yeah.
it did. And obviously, as I continued to come, we went through different traumas and different things.
Yeah.
And I can honestly say, hand in heart, that the ones that were torturing me and brought me I didn't want to be here are gone. They're
That's
really
brilliant.
gone. You know, I've had these for years, you know,
Yeah.
and like
And it's interesting because, like you say, you spoke quite a lot during it because I think it was just so overwhelming for you, wasn't it? That it was like, oh, I just need someone to just get this out of me. But actually, as soon as we kind of went through anything where I thought there was a little bit of emotion, we just worked on that straight away without going any further and let you kind of release it. And I think that's such a nice way to work. If people do, if you want to talk or whatever, then that's fine. But there were some that we just used one word, and that was it.
Yeah.
Yeah.
That's it. And the memories were in my head. And actually, sometimes it brought up things that were really, really hidden that I didn't even remember, and like as we were doing a session, I would go, oh my God. So we would then like kind of work on that then.
Yeah. So as we cleared one memory, some kind of lesser memories, I suppose, were kind of revealed so that we could, yeah. And how did you find the sessions? Obviously, were you kind of emotional? How did you feel afterwards?
I found really like during this time when I've had what I class as a breakdown, like I haven't cried, I really haven't cried, which I find strange. But like after it, I was just like incredulous, to be honest with you. I was just like, I was dumbfounded, is it honest? Like, obviously, I felt a lot lighter, because we worked on the ones that were the worst initially, and like, yeah, like I thought maybe I've seen people before and they burst into tears and everything like that, but that part never happened for me. But like, it was still really emotional, and like as I say, when I left, I was just questioning it all in my brain, like
trying to figure it out.
But I'll tell you what, after that first session, I was desperate for more. I'll tell you, I signed up for a package.
And it was quite nice on the second session to kind of work on specific things that were, it was like, this is what I want to target, because I think that's the main, when you're so overwhelmed, like it's really hard to pin down the specifics. Obviously those first couple of flashback memories that you had, but second session was more kind of, oh, this is what we've got here, this is what we're dealing with. And I know I think I always say to my clients that you call me a magic pixie, because it's like, that's what you think.
I know, some magician, something, I don't know what it is.
So, you obviously we'd had like probably 3 sessions really to just get really into it. After those 3 sessions, what kind of changes had you made in your life?
Well, I had started to go out the house more, like because I had started to become a bit of a hermit and just staying in the house. I was starting to think about going back to work again, like what I would basically what I wanted my life to look like, what I wanted for the future. Like instead of dreading the future and thinking there wasn't going to be a future and this was always going to torture me, I started to think, right, okay, how's my future going to look? What am I actually going to do with it? And I started like enjoying more things, enjoying my time with the kids, and things like that a lot more,
and just not feeling so restricted. Is that right? Yeah.
And like just freer, like just as I mentioned initially, I've got complex traumas, so we did like kind of number, right, okay, what's most important, what's like, and so there was a good wee bit to work with. That's why I think your packages are really, really good.
Because that's what we're working with now, aren't they? Kind of over a long period of time, these 8 sessions, which you've taken a pull back when you're feeling like it's too much, but then I mean you're away at the moment, enjoying a bit of sunshine, which is lovely, and really making those decisions and creating that life together, really working on the goals that you've got, but also a lot of some of the underlying health issues that that have been affected by those kind of traumas and things that you've experienced in your life. So I mean, that's what I really love about IEMT, is that it's able to break that down. It doesn't take quite so long. And I know that sense of freedom, because I've
Couldn't
obviously
believe it.
experienced it as well. Yeah.
It's unbelievable. It really is unbelievable. Like, because I thought, oh, here we go. Because I have had like therapy,
Yeah.
CBT or whatever from the NHS, God, about 10 years ago or something like that when my son died.
Mm.
Like, and it was just talking, 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 never getting anywhere, you
And
know.
how did you find that in comparison to obviously working through, because it's quite quick, isn't it, IEMT, the
Oh,
way?
unbelievable. Like, as I say, I came into you tortured with certain memories and I left you and they were like anytime I try and think, even right now, if I try and think about that, it's just grey, it's all misty. I
Yeah.
can't think about it, So that's how quick it was. It was one session,
Mm.
just one session. I needed more because, as I say, the complex traumas.
Yeah, it's just really working on, together. And obviously you've been referred out to other people as well. And this is why we're taking a bit of time. But, we don't use the eye movements unless something really comes up
Yeah,
that is just buried. But to be honest, that's very rare. We really work on where you're going now rather than, you know, the
yeah,
past, which is lovely.
yeah.
So
And
if
I
you
have
can,
made, like,
yeah.
sorry, like, I remember when, like, near the beginning, you said to me, right, okay, we're going to decide where you're going to be in, say, 3 months from now. So that would be, like, say, the 3rd of August, around about that time. And I knew what I wanted my life to look
Yeah.
like then. And part it was getting rid of a big part in my life.
Mm-hmm.
And at that time, I couldn't see a way of that happening. I just couldn't. I'd been modding it for a couple of years, and I couldn't see a way. But for some reason, like I'm free of that
Yeah.
person also as well now,
Yeah.
and that's me looking at like job opportunities and everything, and that was the plan, you
Yeah.
know.
Yeah. And it's nice to kind of set those goals and have someone like to be accountable to,
Yep.
maybe.
And then
Um,
I've learned totally new concepts from you, like manifestation, journaling. Like I
the
even
woo-woo
like
stuff that yeah.
I even like totally spooked my son and his girlfriend out when like you told me to write down what I wanted and
Mhm.
then burn it. I think was it the full moon or something like that.
Well, it's a
And
release. It's kind of just what don't I want in my life anymore? Let go. And then, we do
can I
that
be
thing.
100% honest with you?
Absolutely.
While myself and my friend was sitting at the beach today, I was telling her about that. Now she wouldn't have thought I'd done anything like that either, right? Now I thought back to what I'd done that night, and do you know what? It came true.
There you go. So
And
working with those energetic cycles as well, and just it's being aware, really. I know we call it manifestation and woo, but actually it's just bringing up into awareness what's really going on internally and kind of seeing if we can reflect it in our external world. And not everything happens, but we kind of, because we've set that intention, we
mm-hmm.
work with it, we start to go into flow. And I think being able to work with, because obviously you in your package you get like personalized meditation, which has helped with your sleep a lot, and there's obviously tools and
Yep.
journaling stuff that I send you in between, things that like to invite you, this is what I would do. And that document that I send you is with you, for life, really, to
Mm-hmm.
kind of see where you want to go and keep working on your own to really kind of build your own life
But
again, which is lovely.
yeah, but you're always there. You're always at the other end of a phone, a WhatsApp. Do you know what I mean? Like you take your job above and beyond. It's not
Mm.
like just like you go and see a wee woman in an office for an hour and then you don't see her for like 3 weeks later, and then
Yeah.
you're like maybe in the middle of a really emotional crisis, like, and then it's all right, sorry, your time's up, you need to go.
Yeah.
It works totally different.
And it
um
and it is, because it's more like a coaching, it's a coaching experience, isn't it? Rather
mhm.
than, it's like
Yeah,
working with you to find out what you want and bringing out the best in you, really.
well, I
So
think that you've like freeing up the parts of my brain, and I know you explained it all to me, and the like, um, freeing up the parts of the brain that were so bogged down with the
mhm.
traumas,
Yeah.
like that's allowed me to see clearer now and see, right, well, do you know what? Things that I thought were dreams before, like I'm not saying I've won the lottery or anything like that, right? But I mean more realistic things.
Yeah.
Like you've gave me like the belief in myself again, if you like, and the coaching,
yeah.
and everything to think, do you know what? I can go and do that again. I can be that person again, and that's what I'm doing. You
So
know,
if you could sum up in, in a word to describe where you were in March and then describe a word now, how would you put
suicidal,
that? Yeah.
and a lot more hopeful. And it's me. It's really difficult for me to come up with one word.
You did well.
Like when I say hopeful, I don't mean like things haven't changed. I'm not saying every day is absolutely fantastic. There's still work to be done, but I've made a lot of changes in my life.
Yeah.
I've got rid of a lot of dead wood that also bogged me down, as well as the memories and things like that. So I'm working towards being back to what I want.
Yeah, resilient, independent. Yeah, and that's
Yeah,
really good. How does that
and
feel?
feels great. And the important thing is, I've totally when that happened in February, I was on so many tablets. I have reduced and I'm continuing to reduce my tablets
That's so
at a
good.
safe rate while I'm
Yeah,
here.
yeah.
I'm
No,
taking
that's
more
good.
like not notice of what's in foods, because as you know, I've had a really bad ill health this whole year,
Yeah,
as well, like physically. So I'm paying more attention to, like, I'm taking a lot more vitamins and probiotics and
brilliant.
more nutrients in food and things like that, rather than the chemicals that the doctors just want to give you, the
Yeah,
pharmaceuticals.
that's so good. And it's so good to see you out there sunning yourself as well. So thank you so much, Kirsty. I really appreciate your time. And I'm sure I'll see you very, very soon.
No, and I really appreciate you. Like honestly, you, as I've said to you before, you gave me my life back, and
Mm,
that's my family. Everybody's grateful for it.
yeah. Well, you've got a right to be here, and it's wonderful to have you here still. So thank you.
Thank you.